Hello, I'm Congressman Hal Rogers. While I regret that I can't be with you in person this morning, I join you in spirit. Few issues are as dear to my heart as ending the abuse of prescription drugs. I want to thank United Healthcare and Optum Rx for hosting this important roundtable discussion about one of the biggest challenges confronting our nation. For the last 50 years, illegal drug use of so-called hard drugs has been a perennial law enforcement problem. The emergence of prescription drug abuse and the illicit diversion of prescribed pharmaceuticals calls a much broader coalition into action, particularly our health care system, our drug manufacturers, our doctors, our patient providers, policymakers. It's an epidemic that began in the hills and hollers of Appalachian, Kentucky, and serves as the front line for this battle. In my community, local hospitals were experiencing more than one overdose per week. Families had been overrun by pain pills, and a feeling of hopelessness had begun to pervade the entire region. These powerful drugs, intended to manage pain, were suddenly creating pain in the form of overdoses, crime, uncontrollable addiction. While the first wave hit Appalachia, this second wave is now hitting the streets of Boston, suburban families in L.A., and countless communities in the South. Now the diversion of prescription pills is the fastest growing drug problem nationwide, with abuse transcending state lines and socio-economic groups. The statistics are troubling. In 2010, 254 million prescriptions for opioids were filled in the United States. That's enough painkillers to medicate every American adult around the clock for a month. The number of emergency room visits because of prescription drug overdoses has increased by over 400% in the last 10 years. According to the CDC, drug overdoses are second only to motor vehicle accidents and accidental deaths in this country. It has to end. The future of our next generation hangs in the balance. Undoubtedly, this is a complex issue. How can we ensure that patients with legitimate medical needs have access to these life-saving drugs while keeping them out of the hands of hopeless addicts and unscrupulous drug dealers? I've long advocated that it will require a concerted, multi-pronged approach to curb the rising tide of prescription drug abuse. Law enforcement, treatment, education. They all have a vital role to play, just like everyone sitting in this room today. I applaud you for coming together today to hone in on the issue of prescription drug fraud. In Medicare Part D alone, it's estimated by a GAO that hundreds of thousands of people are abusing the system, primarily by doctor shopping, costing our taxpayers $150 million annually. One Medicare recipient visited 58 different doctors to obtain 3,655 oxycodone pills. These taxpayer-funded pills equate to about $300,000 on the street. There are thousands more just like him around the country, and that's why we absolutely need to tackle this fraud issue head-on. Getting rid of rogue pill mills and cracking down on so-called doctor shopping are two important cogs in the wheel. In 2002, Frank Wolf and I started a grant program in the Department of Justice to help states develop prescription drug monitoring programs that monitor controlled substance sales and purchases. PDMPs bridge the gap between legitimate medical need and potential misuse. Now nearly every state in the nation has a program in place, and efforts are underway to ensure that these programs are interoperable with real-time data. Your support for these programs will be absolutely vital moving forward. But we must do more. Folks across the spectrum have a role to play in addressing prescription drug abuse. First, drug manufacturers. Pain drugs generate $11 billion in revenue last year. Manufacturers have a responsibility to develop effective drugs which are resistant to abuse, and to ensure that they are accurately educating prescribers about the benefits and risks of these drugs. To that end, physicians must do their due diligence to learn about these drugs and to utilize the PDMPs already at their disposal. Congresswoman Mary Bono Mack and I have introduced legislation requiring greater physician education. And I'm encouraged by the developments in the technological sphere to ensure that doctors and pharmacists can get an accurate, holistic, and real-time picture of a patient's medical history without disrupting workflow. Third, the non-medical use of prescription painkillers costs the insurance industry $72 billion annually in direct health care costs. Not only are these companies paying huge amounts for unneeded prescriptions, emergency room visits, and rehabilitation, but there's a human toll. The insurance industry is already taking impressive strides to expand and enhance data monitoring and to implement restricted recipient programs where necessary, so that patients suspected of doctor shopping will be locked in to one doctor on one pharmacy. I believe the industry should also consider the effectiveness of medication monitoring tests. Finally, policymakers, to include lawmakers and regulators at all levels of government, ought to be more engaged in this life-threatening issue. Along with Mary Bono Mack, I created the Congressional Caucus on Prescription Drug Abuse to raise awareness of abuse and to work toward innovative and effective policy solutions, incorporating treatment, prevention, law enforcement, and research. Rest assured that we will continue to advocate for all policies that support all stakeholders in bringing this era of rampant abuse to a close. In conclusion, as we work to get our country's fiscal house in order, our efforts to reduce prescription drug fraud are a win-win. We can reduce costs in our overburdened healthcare system while simultaneously protecting the lives of Americans. Today's discussions will accomplish more than simply identifying the tremendous scope of the problem and the dire implications for the next generation of Americans. I hope this roundtable will facilitate ongoing conversations and enhanced collaboration among federal, state, and local officials, advocacy organizations around the country, our health and law enforcement communities, and the men and women suffering or recovering from abuse about solutions. Thank you for allowing me to participate. We wish you luck. Godspeed.